Welcome back. The next chapter we're covering in the Standard Aesthetics book is Chapter 5, Skin Analysis. The learning objectives for this chapter is to explain the process of skin analysis, identify the 4 genetic skin types through visualization, palpation, and consultation, differentiate the 6 Fitzpatrick skin types and accurately identify them, distinguish the characteristics of sensitive skin, recognize the intricacies involved with treating skin of color, identify treatment options for the neck and décolleté, illustrate examples of skin conditions, explain the causes of skin conditions, describe healthy habits for the skin, determine treatment contraindications through evaluation, analysis, and consultation, and perform a skin analysis. Knowing about different skin types and different skin conditions is extremely important for what we do because we need to be able to recognize different skin types and conditions and base off products that we would use on them or products that we would recommend clients to use. So that's why knowing about how to do a thorough skin analysis is important so we can determine what skin types and condition the client may have. Before you do a service on a client or before you select their products, you really need to determine their skin type and any skin conditions they may have. So by doing a skin analysis, you can then determine what products would be best for them. So trying to figure out any causes of skin conditions or any contraindications a client may have, you can do your skin analysis, but also doing a very thorough client consultation is very important to figure out their signs and symptoms that they feel they have on a daily basis or what aggravates certain conditions and things like that we might not see just in an hour. So skin type itself is a classification that describes a person's genetic skin attributes. So it's determined by our genetics, but it can be determined by ethnicity, but it can also change over time. So for example, typically clients that age, as we age, our oil production kind of slows down. So most of the aging population, not all of course, but most start to have a little bit drier skin. And skin type is also just based on how much oil is produced in the follicles from the sebaceous glands and the amount of lipids found between the cells. So skin type itself is based on oil production or lack of oil production. A really good way to determine someone's skin type is by evaluating their T-zone. So the T-zone is the center area of the face corresponding to the T formed on the forehead, the nose, and then the chin. So it makes a T on the face. That's the T-zone. Determining the pore size in that area can really give us a good indicator on what that skin type is. So when you do a skin analysis, you really should be looking at visualization, so using your visual abilities to note properties in the skin. So pore size, you can see pore size, any irregularities, any sunspots, any hyperpigmentation, those are all things that you can see. Palpation is also a way of identifying skin type. So palpating is touching the skin and manipulating it so you can see the elasticity of someone's skin. You can feel texture on someone's skin. Do they have a lot of bumps on their forehead? Do they have a lot of pitted scarring on the sides of their cheek? That would be things that we would palpate or touch. And also consultation is one of the best indicators to determine that client's lifestyle and dietary issues that could impact their skin as well. And also just give us a general overview of how they feel their skin is most of the time. Because again, if we only see them for an hour, maybe they have a good skin day, maybe they have a really bad skin day. We don't know. Maybe they're on their period and they're just breaking out a lot more. So getting more information by talking to that person is going to make a big difference in what we would use to treat them. So the 4 skin types, remember, the skin types are based on oil production. We have normal, combination, oily, and dry skin. When we say normal skin type, a lot of the times we're going to mean balanced skin. So oil production will be balanced, so a client wouldn't be too oily, they wouldn't be too dry. Hydration levels are also going to be balanced, so how much water is in the skin. Follicle size would be very small, and you could probably see it, but it's not going to be extremely tiny like a drier skin type would be. The appearance would be uniform and no or rare blemishes. The feel of the skin would be soft, smooth texture, and good elasticity. When we think about how to treat normal skin types, we're really just not really treating per se, as more of it's just maintenance and preventative measures that we're taking. So we can still cleanse the skin, exfoliate the skin, and nourish and protect the skin. So in normal skin, body systems are functioning more holistically for balance. Again, it's a balanced oil production, balanced hydration levels. It's going to be most common in clients in their 20s and 30s. And for expert tips, what we would want to introduce them is some anti-aging products as they mature, just for, again, preventative measures. Skin might become drier as clients age because, again, as we get older, typically oil production slows down. And then we would also reinforce the use of sunscreen with anyone, really, because, again, that's going to be more of a preventative measure from aging or irritation, dark spots, anything like that. When we think about combination skin, it's exactly as it sounds. It's a combination. So typically there's going to be areas on the face that are oily and maybe another area that's either normal or dry. So oil production may be moderate to high. Hydration levels could be good or dehydrated. The follicle size may be larger in their T-zone because typically that's going to be where the oil production is the most. And the appearance might be a buildup of dead skin cells and oil in their pores around their nose, dry or flaking on the outside of the T-zone, so like more on the cheeks, and they may have some blemishes and comedones. And then if we're feeling their skin, we may notice that they feel oilier in the center of their T-zone. When we're treating combination skin, we can have the client cleanse and regularly exfoliate. We can also have them use water-based products to keep their hydration levels adequate. Also avoid harsh products and rough exfoliation, so their skin isn't becoming irritated. So what causes combination skin? Well, a lot of the times it's overproduction of oil in the T-zone. Some people may have a normal production of oil in the T-zone, but more dehydrated or drier skin on the sides of the face. What we would want to do as an esthetician with a client that has combination skin is to evaluate their skin often, because oil and hydration levels can be disrupted by hormonal and environmental influences. So we kind of have to keep track of what their skin type is at any given visit. And then also, of course, reinforce the use of sunscreen. For oily skin types, there's going to be more of a moderate to high level of oil production in the skin, and hydration levels, because of that oil, is more likely to be good. So they're going to have a lot more water in the skin typically, just because that layer of oil keeps that water in the skin. But people can still be dehydrated with oily skin. The follicle size or the pore size on oily skin will be more moderate to larger. The appearance of their skin may be shiny. They may have comedones and blemishes that are present as well. And the feel of their skin may be thicker and firmer, and they may have uneven or textured skin due to congestion. Treating oily skin, we would want our clients to regularly cleanse and exfoliate, and then we would also probably recommend them more hydrating water-based products. And the treatments that we do on them would be to try to balance their oil production. Oily skin type is really just due to overproduction of oil, mostly due to genetics, hormonal changes. It could be due to medication, stress, or any environmental factors. So typically, people that live in more hot, humid climates may be more oily than people that live in drier, colder climates. Also, overexfoliation can create people to become a little bit more oily because the sebaceous glands are working to increase that surface dryness from overexfoliating. So there are some downsides with oily skin, being that clients with oily skin are more likely to have breakouts or comedones and also have them on the neck, back, shoulders, and chest. But there is also a benefit to having oily skin. Clients with oily skin are going to age more slowly since all of that oil acts to protect the skin. And like everyone else, clients really should use SPF as well. And for oily skin, it can be important to avoid any post-inflammatory hyperpigmentation since they are more prone to acne and dark spots that come after acne. For dry skin types, oil production is going to be minimal. Hydration levels would also be minimal. Their follicle size or their pore size is going to be very difficult to visualize, so they have very small pores. Appearance of dry skin is going to be more dull. It might have a lack of luminosity. It might be flaking, and it could be blotchy as well. The skin may feel a little bit more rough. It may be more thin, and it might feel tight as well. To treat dry skin, we want to use more oil-based products that would help provide more protection of their acid mantle and increase the barrier function. So things high in lipids and ceramides. Dry skin also has a compromised transepidermal water loss, or TEWL, which is just water loss caused by evaporation from the skin's surface. So water is leaving their skin a little bit more, so also including more hydrating products in their skincare routine as well. When we do treatments on dry skin, we want to include products that are more nourishing and protecting. So just remember that dry skin is an underproduction of oil, and it can be from genetics, it can be environmental. If someone lives in a cold, dry climate, it can also be hormonal, or as we've aged and maybe gone through menopause, our skin typically is going to be less producing of oil. And some expert tips: dry skin may often be dehydrated. So remember that dehydration can be in any skin type, but it's going to be more commonly seen in drier skin types just because they don't have that oil to protect the transepidermal water loss. And again, with anybody, we want to reinforce the use of sunscreen. Next, we're going to go over the Fitzpatrick scale. So the Fitzpatrick scale is what we use to measure the skin type's ability to tolerate ultraviolet exposure. And because of mixed genetics, there is no true phototype classification system, so the Fitzpatrick scale is just a guideline. In the Fitzpatrick scale, there are 6 types. So type 1 is going to be the fairest, and type 6 is going to be the darkest. And all skin somewhere falls between the scale when evaluated on factors like eye color, skin tone, heritage, and then response to UV exposure. So how quickly someone burns. So someone with Fitzpatrick type 1 will have blue or green eyes. Their hair will be blonde or red. Their unexposed skin is going to be very white or almost translucent, and they may have freckles. Their heritage is going to be English, Irish, Scottish, or Northern European. And their reaction to UV exposure will always burn. They peel with burn, and they do not tan very well. Someone who is Fitzpatrick type 2 will have blue, hazel, or brown eyes. Their hair will be red, blonde, or brown typically. Their unexposed skin is going to be light, and their heritage may be Scandinavian and the same as Fitzpatrick type 1. The skin reaction and UV exposure will burn easily and usually peels, and they tan minimally. Someone who is type 3 on the Fitzpatrick scale may have brown eyes, dark hair. Their skin may be fair to olive tones. Their heritage would be Spanish, Greek, or Italian. And their reaction to UV exposure is that they tan well and they burn moderately. Someone that is type 4 on the Fitzpatrick scale would typically have darker eyes and darker hair. Their unexposed skin would be a light brown color. Their heritage may be Mediterranean, Asian, or Hispanic. Their reaction to UV exposure is that they tan easily, they burn minimally, and this skin type, or this Fitzpatrick type 4, may have more immediate pigment response, meaning that they are more prone to hyperpigmentation. Someone that is type 5 on the Fitzpatrick scale will have dark hair, dark eyes, their unexposed skin will be dark brown, and their heritage is typically East Indian, American Indian, Hispanic, Latin American, or African American. And their skin reaction to UV exposure is that they rarely burn, they tan easily and significantly, and they are also more prone to hyperpigmentation. Type 6 on the Fitzpatrick scale is going to be someone that has dark hair, dark eyes, their unexposed skin is going to be dark brown or black, their heritage is going to be more African American or Aboriginal, and their skin reaction to UV exposure is going to be that they rarely or never burn, and they tan easily, and also more prone to hyperpigmentation. There are also some other classification systems for the skin, so one being the Glogau system, or the Glogau scale, which just basically provides a way to evaluate the severity of photo damage and wrinkles caused by sun exposure on people. So it's a scale that ranges from 1 to 4, 1 being the most mild photo aging and then 4 being the most severe photo aging. And it's just basically looking at sunspots or wrinkles and determining how aged the skin is based on sun exposure. The Rubin scale also is determining the levels of photo damage based off of the skin's depth of changes, and they're looking at pigment and wrinkles, but also more texture, and then again how deep that damage is going. And the Rubin scale also ranges from 1 to 3, 1 being the most superficial damage and then 3 being the most severe damage. Moving on to sensitive skin. So sensitive skin is a condition, so a skin condition, but it's also the result of a genetic predisposition. And it's characterized by the skin's fragility, thin skin, and redness. Sensitive skin is going to flush a little bit more easily, and it may appear red due to blood flow being closer to the surface of the skin and the skin being thinner. Clients who are Fitzpatrick skin type number 1 that have a heritage that's more Northern European typically have the fairer, lighter covered skin that's thinner and more sensitive, but individuals who are multicultural can also be sensitive without the visible redness. Sensitive skin is also easily irritated by products or exposure to heat or the sun. There's something called telangiectasia, which are visible or broken capillaries that are less than 0.5 millimeters from the surface of the skin, and they're caused by either extrinsic or intrinsic factors, and they may be more noticeable on sensitive skin. And these are just more of a visible reaction, and they are alerting us that something might be irritating their skin. So sensitive skin can be a result of someone's age, medications that they may be on, exposure to harsh products, heat, dehydration, or chapping from the cold. Sensitive skin can be more difficult to treat just because there's going to be a lower tolerance to products and stimulation like rubbing the skin, heat, exfoliation, or extractions. The treatment for sensitive skin is going to be more gentle and non-irritating products, calming products, and calming treatments. And the primary goal for someone with sensitive skin is going to be to soothe, calm, and protect their skin. And I would say with anyone with sensitive skin, even if it's sensitive skin with acne, I always try to recommend people treat the sensitivity first, or the sensitive skin part first, before going in with acne products, because acne products are going to be a little bit more irritating to someone's skin. When you're doing a skin analysis, you want to find out what's causing the sensitive conditions, Is it something that's natural? So is it something that it's just hereditary that they're sensitive, they've always been sensitive? Or is it something that they've been exposed to? So is it that they're overusing products? Like that, typically that's my problem. If my skin's a little sensitized, it's because I'm overdoing it with different products. So you want to find out what's causing the sensitivity in their skin. So our first question for this lecture is, why is sensitized skin challenging to treat, and what are the goals for treating sensitized skin? Moving on to melanocytes. So something that's interesting is that all Fitzpatrick skin types, so Fitzpatrick 1 to 6, have the same number of melanocytes. The difference is just that the higher skin types, so Fitzpatrick 4 to 6, typically have melanocytes that produce more melanin. And the differentiation is going to depend on the ethnicity and the geographic location. So for example, someone that lives along the equator is going to have more active melanocytes than someone that lives at the North Pole, because the melanocytes are going to produce more melanin to protect the skin from the UV radiation. Going into a deeper dive on Fitzpatrick skin type 4, Fitzpatrick type 4 is considered to be one of the most challenging skin types to treat well. The skin, though, also has great elasticity and firmness, and it does not show signs of aging as quickly as Fitzpatrick skin type 1 and 2. With Fitzpatrick type 1, it can become more hyperpigmented from treatments or aggressive exfoliating agents, so it's recommended to use more gentle exfoliating products, and you may need to add more melanin suppressants or other skin lighteners to the skincare routine to prevent or treat hyperpigmented areas. Also, sun protection will help slow down hyperpigmentation, and someone with type 4 should avoid sun exposure and use sun protection daily. So that's the case for anyone that is prone to hyperpigmentation. Someone who is type 5 or 6 on the Fitzpatrick scale typically has more oilier skin and thicker skin, but it can also have the same level of reactivity as lower Fitzpatrick skin types, and reactions may be more challenging to see on darker skin, but they can be as intense on those as lighter skin. Fitzpatrick types 5 and 6 are also more prone to a form of hyperkeratosis called ichthyosis, and this is just a dead skin cell buildup, and so these clients may need more exfoliation and a more often deep core cleansing. Fitzpatrick types 5 and 6 are also more prone to having abnormal hypertrophic scarring called keloids, and sun protection is still necessary for these skin types to prevent hyperpigmentation. The skin on the neck and décolleté, which is pertaining to the lower neck of and the chest, is not the same as the skin on the face because it has fewer sebaceous glands, so fewer oil glands on the face than the face does. It tends to show more aging a little bit more quickly, and it's also more susceptible to irritation. So photo damage, broken capillary, fine lines, and wrinkles develop just as much or worse. Tech neck is a newer phenomenon caused by the repetitive movement of looking down at a cell phone or other electrical devices, and it's created a demand for specifically topical treatments that include antioxidants, growth hormone serums, and additional moisture to treat the kind of like the wrinkles that come from tech neck. Because the neck and décolleté is a little thinner and more sensitive typically, you do need to be cautious when applying vitamin A's or alpha hydroxy acid products that can cause more irritation in that area. And a product like retinol can be fine for the face, but it might be too aggressive for the neck. So something that I like to do, since my neck is a little bit more sensitive than my face when I do use retinols, I like to apply a layer of moisturizer over my neck, and then I apply the retinol over top my face without moisturizer on, and then my neck with the moisturizer on. And I kind of find that helps ease it so it's not so strong. There are a lot of internal and external factors that can affect the skin's condition on someone. So skin conditions are going to be more than the genetic makeup. So they are what we would be more concerned about, and they are going to be the focus of the skin treatments that we do on someone. The most common skin conditions that we would probably see are adult acne, extrinsic aging, and problems relating to hormone fluctuations. And we as estheticians can improve some conditions through regularly scheduled skin treatments and by using specialized products. And then also we need to make sure that we're avoiding the factors that affect the conditions, and we should be noting any conditions on the client's chart, and then also how they're progressing as we move forward with treatments. So acne is a sebaceous breakout from hormonal changes or other factors. Actinic keratosis is rough areas resulting from chronic sun exposure, sometimes with a layered scale or scab, and these can be precancerous. Aging is skin laxicity due to collagen and bone loss, thinner skin, dryness, photo damage, and fine lines or wrinkles. Asphyxiated skin is common in smokers because they experience a lack of oxygen. There may be clogged pores and wrinkles, dull and lifeless looking skin, and their skin tone may be a little bit more yellowish or gray in color. Comedones are either open or closed. So open comedones are also called blackheads, and they're clogged pores caused by a buildup of debris, oil, and dead skin cells in the follicles, while closed comedones are also called whiteheads. They are not open to the air or oxygen, so they are trapped underneath a dead layer of skin cells, and they need to be exfoliated and or extracted. Couperose skin is redness in the skin with no visible vascularity because the matting of blood vessels is small and fine, and this is often seen with telangiectasia. Cysts often have fluid, infection, or other matter in the skin that is encapsulated in a papillable firm mass, and the size is going to vary. Dehydrated skin is also a skin condition, and this is just a lack of water. So it can be caused from the environment, medications, topical agents, aging, caffeine intake, or alcohol intake as well. Enlarged pores are just larger follicles that are from excessive oil or debris trapped in the follicles, or they can also be due to an expansion from loss of elasticity or trauma. Erythema is redness caused by inflammation. Growths are just skin cells and underlying tissue that overproduce and create an area that can be raised or flat, and they can be distinguished with palpation or with feeling. They may be the same color as the surrounding tissue, or they could be pigmented, and can also be present at birth or develop later. Herpes simplex 1 is a cold sore, so it's a communicable virus that appears as a vesicle on the lip that's similar to a blister. Hirsutism is excessive body hair located in the regions where hair is not normally present, so facial hair for women, and it's commonly caused by a hormonal imbalance. So polycystic ovarian syndrome, or PCOS, is a possible cause, and signs and symptoms of PCOS include irregular or no menstrual periods, heavy periods, excessive body or facial hair, acne, pelvic pain, difficulty getting pregnant, patches of thick, darker, and velvety skin. Hyperkeratinization is an excessive buildup of dead skin cells or keratinized skin cells. Hyperpigmentation is an overproduction of melanin, and it can be caused from UV exposure, so from the sun, tanning beds, fluorescent lighting, and it usually appears as diffused brown spots of various shades on the skin. It can also be from hormonal factors, so this would be called melasma. Post-inflammatory hyperpigmentation, or PIH, also occurs from a surface injury to the skin, so it can be from an acne lesion, it can be from an insect bite or ingrown hair, and those are going to be the more common causes of post-inflammatory hyperpigmentation. They can also appear a more deeper red, almost purple, to a dark brown in color, and they can gradually fade, but you would want to make sure you're using sun protection and ingredients that help lighten the skin. Hypertrichosis refers to excessive hair growth, whether it's caused from a hormonal imbalance or hereditary. Hypopigmentation is lack of melanin, and this can be UV induced. So with this, there's really no treatment options, but you can help lighten the hyperpigmented areas, which can help then blend the hypopigmented areas so it's less noticeable. Hypopigmentation can also be post-traumatic, so there may be a lack of melanocyte production due to an injury, burn, or other trauma, and melanocytes can begin producing again over time, but the length of time is undetermined. Vitiligo is an autoimmune disorder that stops melanocyte production, and it creates patches of depigmented skin. There are some topical prescription drugs that can occasionally trigger the rejuvenation of the melanocytes. Albinism is a hereditary disorder that causes lack of pigment in the skin, eyes, and hair. Irritation is usually just redness or inflammation, and it can be from a variety of causes. Keratosis pilaris is a buildup of cells, and it's like a rough texture. Typically it's like on the upper arms or the butt or the back of the legs, and this is sometimes called chicken skin. Melasma is a form of hyperpigmentation, and it's characterized by bilateral patches of brown pigmentation on the cheeks, jawline, forehead, and upper lip, and it's due to a hormonal imbalance, so it can be caused from pregnancy, birth control pills, or hormone replacement therapy, and it typically gets worse with sun exposure. Milia are hardened pearl-like collections of oil and dead skin cells trapped beneath the surface of the skin. Milia are not exposed to oxygen and have to be lanced to open for removal, so we can't really extract them in Illinois because we can't use lancets. But milia are typically the size of the head of a pin, and they're typically more common around the eye, like right under the eye. Papules are raised lesions or just blemishes in general. Pore elasticity is just skin laxity from most likely damage or the sun and general aging. Pustules are infected papule with fluid inside, so you can tell the difference because you will see a little, what looks to be a white head, but you can tell it's not a white head because there's inflammation, and then the actual head itself looks a little yellow toned. A scar is just a mark on the skin where there was a wound, a burn, or a sore, and it's healed over and left a fibrous band of connective tissue. And sometimes they can be hyperpigmented, and sometimes they can be hypopigmented. Sebaceous hyperplasia are benign lesions that are seen on oily areas of the face, and they're described as looking like donut holes, and these can't be extracted. Seborrhea is also called seborrheic dermatitis, and this is also called dandruff in the hair, and it's caused from an excess oil production, and it causes redness, irritation, and flaking. So sometimes people might get flaky even in like the eyebrows or kind of around the eyelashes, and there may be an oily skin type. So to treat that would be to treat as it is seborrhea, and you can actually use some anti-dandruff shampoos on the face, almost like a mask, to help treat that, and that would kind of clear it up if it is truly seborrhea or seborrheic dermatitis. Sensitivities are physical reactions like erythema, so redness, edema or swelling, wheals or hives, itching, stinging, or discomfort from an internal source or an external source on the skin. Solar comedones are large open comedones, usually around the eyes, and that's from sun exposure. So solar makes sense because solar and sun mean the same thing. Striae or stretch marks are just dermal scars due to rapid expansion of stretching of the skin or connective tissue, and they leave deep red, pink, or sometimes purple linear marks on the skin, and they do gradually fade over time to light pink or kind of silver tones, and they often occur during growth phases and during puberty, during pregnancy, or just general weight gain. Sun damage is just UV damage to the epidermis and dermis layers of the skin, and the effects of sun damage are wrinkles, collagen and elastin breakdown, so people start sagging a little bit more, hyperpigmentation or pigmentation issues, and then also cancer. Telangiectasia are visible broken or distended capillaries that are less than 0.5 millimeters in the skin due to extrinsic or extrinsic causes. So there's an example of telangiectasia on this middle of the screen there. Wrinkles due to aging skin are also called rhytids, and they are lines and damage from internal or external causes. So external would be something like the sun, internal would just be the natural aging process. Our second question is, how are skin conditions different from skin types? So getting into what ages us, or even what ages us quicker, we have extrinsic aging, which is our natural aging process. This is something that we can't really do much about, because as we age, collagen production is going to decrease, the cell turnover is going to slow down, and factors would be time, genetics, and then also gravity. Extrinsic aging are going to be the things that we have a little bit more control over. So external factors or outside factors that speed up the whole aging process. So factors would be sun exposure, smoking, drinking, stress, unhealthy diet, lack of sleep, and also lack of exercise. Signs of aging would be hair loss, gray hair, thinner skin, dry skin, wrinkles, hollowed sockets, and sunken cheeks. So a little bit of a deeper dive into external factors that affect the skin. Some skin conditions can be caused by allergens or reactions, medications, medical conditions, and other external or extrinsic factors. A primary example would be UV exposure or sun damage. So it's good to remember that sun damage is the main external cause of aging. So that is why it is extremely important for us to tell all of our clients the importance of SPF or just covering up when they are going to be outside. Therefore, also tanning beds is going to be something that we would advise our clients not to do. Also, environmental exposure, pollutants, and air quality can affect our skin, and being exposed to free radicals. Environment, climate, and humidity can also affect our skin types even. Poor maintenance or inappropriate skincare, and also the misuse of products or treatments. So like over exfoliation or using products that are too harsh for the skin can cause inflammation, and that can also speed up the process of aging. Allergies and reactions to environmental factors or products as well. And then also photosensitivity to the sun from medications or other products. So for example, AHA is a big ingredient that causes photosensitivity. So I never recommend a client to start using an AHA, or I don't recommend a client do a chemical peel if they're not someone that would use SPF frequently, or they're not good about covering up, because it can cause more damage than good in their skin. Internal factors are going to be factors that are intrinsic or in intrinsic health that affects our skin. And remember that some of these we can't help, but some of them we may be able to help a little bit. So genetics and ethnicity influence conditions we can't really help. Free radicals we might be able to help fight. Dehydration, well, we can always drink more water sometimes. Vitamin deficiencies we can supplement. Hormones can't sometimes help. And then medical conditions like chronic illness, cancer, systemic or diseases like diabetes, impaired immune function, that might not be something that we can really help. Puberty, regular just aging, glycation, which alters protein structures and decreases biological activity. Pregnancy and menopause. Menopause we can't help. Technically, I guess if you want to make an argument, you can help pregnancy, but those are just some internal factors. A lot of them aren't something that we can help prevent, but some of them you technically could. Question number 3 is list 4 intrinsic or internal factors that affect the skin, and list 4 extrinsic or external factors that affect the skin. And now moving on to the top 10 healthy habits for skin. So number one being to avoid sun exposure or use sunscreen daily, eat a balanced diet, do not smoke, avoid excessive alcohol, drink plenty of water, and get plenty of rest. Stay active and exercise regularly, use beneficial skincare products and a regular home care routine, get professional skincare treatments or do them yourself, and implement stress relievers and maintain a calm, positive attitude. And then question number 4 is, what are 5 healthy habits for the skin? Contraindications. I know I've mentioned contraindications a couple of times and you guys may have not known what I was talking about, but contraindications are just factors that would prohibit a treatment from being performed or a certain skincare product from being used on a client's skin. So there could be contraindications that are local. So if someone is breaking out, for instance, say they have athlete's foot, well, you wouldn't obviously want to touch their feet at that point, but you could still do a facial on them if you're not touching their feet. And then there are also systemic contraindications, which would be like a fever or if someone has a viral infection. There are also contraindications that pertain to certain skin diseases and disorders or irritations. So depending on it, you would consider each individually based on the client's overall health. So for example, rosacea may be a contraindication for steam, like you wouldn't want to use steam on someone, or you may not want to do a very aggressive chemical peel on that person, but you could still do a facial on them, like a very calming facial on them. The use of isotretinoin, which is called Accutane, if you've heard of that, it's a oral like high dose of vitamin A that helps treat acne, like very severe acne. So if someone was on isotretinoin, they need to be completed 6 months prior to any treatments that you do on them. Thinning skin or exfoliating topical medications, so like Retin-A, Retinova, Tazorac, Differin, or other forms of vitamin A that are a little bit stronger, you would want to avoid waxing or exfoliation and peeling treatments for a minimum of a week. If you encounter someone that's pregnant, you won't want to do any electrical modalities on them. You would not want to do a chemical peel or any aggressive or use any aggressive ingredients without medical permission, without their doctor's permission. And some clients can experience more sensitivities from waxing, or generally sometimes pregnant clients are just a little bit more sensitive in general. So and people's skin change, especially with all the hormone fluctuations. So I typically would do, starting out, if I see someone over a couple times while they're pregnant, I may start out with a more sensitive skin facial on them. If someone has metal pins or plates in their body, you would want to avoid doing any electrical modalities on the area that the pin's located or the plate's located. If someone has a pacemaker or a heart irregularity, you would also avoid any electrical treatments that require a grounding pad. If someone is allergic to something, obviously you would avoid that allergy if it's in the form of a product ingredient or something like that. And clients that have an allergy to aspirin should not use products that have salicylic acid because they're both derived from willow bark. And clients with multiple allergies should use typically more fragrance-free products that are designed for sensitive skin. If there's a client that's prone to seizures or has epilepsy, you would avoid all electrical and light-based treatments that pulsate, and you would want some written permission from their doctor. A client has history of seizures. If someone is on oral steroids or cortisones, you would avoid any stimulating, exfoliating treatments or waxing, since skin can be more fragile and bruise a little bit easier until the client's been off the medication for at least 2 weeks. Clients that have autoimmune diseases like lupus or vitiligo, I would say treat them as sensitive skin because you want to avoid anything that's harsh or stimulating treatments or harsh products. You want to be careful with people that have uncontrolled diabetes, so people that don't have good control of their insulin levels because they experience slower healing. So if people have diabetes, are experiencing neuropathy and nerve damage to the extremities, they may not feel pain in that affected area, so you also have to be more careful there too. You also want to use caution when performing any extractions or when you're waxing someone that's on blood thinners or ibuprofen or NSAIDs. So the client consultation is extremely important because it's going to overall help us determine what treatment is appropriate for that client or what skincare products would benefit the client's skin the most. It's also going to help us determine why a client's unhappy with their skin, so what issues we should address first, and what internal and external factors are causing problems in their skin. So the more you know about that client, the more appropriate recommendations you can make for skincare and for treatments that you could do on that client. Before you start a consultation, you can ask yourself these questions. Is the client comfortable? Is your work area freshly cleaned and uncluttered? Are appropriate tools ready for use? Do you have materials to explain benefits or ingredients? You can also ask, do you have photos of the actual treatment process? And will you be able to discuss who the best candidates are for specific treatments? So we'll kind of breeze over the next couple slides here because I know we went over them in that first Foundations book. But the intake form, also called client questionnaire, health history form, or consultation card, this is a form that needs to be completed from clients and updated each visit if anything has changed. So the intake form is just basically disclosing any health history, any products or medications, medical conditions, known allergen or sensitivity, client's at-home skincare program, and any skincare treatments that the clients recently received or anything that's adversely affected them. And information should include details about the client such as their name, age, occupation, diet, and then lifestyle habits as well. And the first time you mention an intake form to a client is going to be when you're on the phone with them booking them. If they're a first-time client, you would want them to come about 5 to 15 minutes early so they have time to complete it, and then you also have time to do a thorough consultation with that client. A consent form or a consent to treat release is a customary written agreement between the esthetician and the client that's applying for a treatment, and by signing, the client's acknowledging that they understand the procedure and the risk involved, as well as releases you from liability before you perform the service. When you introduce the consent form to the client, you want to review all of the steps involved in the treatment that you're going to be doing on them, and be sure to explain any home care directions if necessary. And you want to provide a client the copy of the consent form and then keep the original for your files. And it's wise to maintain a treatment log and have the client initial and date all of the subsequent treatment procedures. The client chart or service record is our SOAP notes. So this is where we record all of our notes from the skin analysis, the treatment performed, products that we used in the treatment, goals that we're working towards, and then home care recommendations that we recommended to our clients, and then any other consultation notes. And it will be needed every visit for that client. So you can keep track of maybe things that you would have done or things that you don't want to do again if someone had an irritation to something. So where to start when you're asking questions during your consultation? A big one I normally start with is the reason for their visit. So I ask what brings you in, because that would gauge whether they're there just to relax and they don't really have that many skincare concerns and they're just there for a basic relaxing facial, or if they're specifically wanting to target something. So what their skin concerns are, if they have any skincare goals, if they have a home care routine, you would want to ask about that. Any prior treatments that they've done, if they've had a bad reaction to a prior treatment, we would want to know that. Any allergies to products or scents. We would want to know what their normal state of their skin feels like, or the different feeling of their skin during different times of the day. Are they like a complete grease ball at the end of the day, or are they still drier at the end of the day? Sunscreen or SPF value, their diet, their water intake, and their activity level can be something that we also ask to kind of get a gauge on their extrinsic factors that can affect their skin. It would be good to know if they're a smoker, if they have any other allergies that we need to know about, any lifestyle stress, or any prior aesthetics procedures that they may have done. So knowing how to analyze the skin is going to be the first step in providing skincare treatments and recommending products that we would use on a client. Identifying conditions and contraindications and providing a thorough consultation while also charting the client's notes are going to be elements that make a good aesthetics practice. You can become adept at doing a quick skin analysis, like while a client's in the waiting room, because sometimes clients don't know what product or treatment to use. So taking a quick glance at their skin, you can kind of gauge on what might be best for that client. Knowing the skin types and conditions and any factors that affect the skin health will help us be able to give an accurate skin analysis. And the best tool that we use to analyze the skin is going to be our mag lamp. But you can also use a Woods lamp, which uses a filtered black light, and that eliminates skin disorders, fungi, bacterial disorders, and also deeper levels of pigmentation. And since client information is personal and confidential, you want to be objective when writing on the client's chart. So records are technically legal documents, and so with a dispute with the client, you want to write clearly and be sure to date all of the entries and sign your name. And to perform a skin analysis, I will refer you to pages 190 to 193. That is procedures 5.1. So for question number 5, you want to describe the steps in the skin analysis procedure and explain what areas the esthetician needs to review during the skin analysis. So our learning objectives were to explain the process of skin analysis, identify the 4 genetic skin types through visualization, palpation, and consultation, differentiate the 6 Fitzpatrick skin types and accurately identify them, distinguish the characteristics of sensitive skin, recognize the intricacies involved with treating skin of color, identify treatment options for the neck and décolleté, illustrate examples of skin conditions, explain the causes of skin conditions, describe healthy habits for the skin, determine treatment contraindications through evaluation, analysis, and consultation, and then also perform a skin analysis. And that will finally conclude our Chapter 5, Skin Analysis, and the Aesthetics Standard book.